Welcome to our Workplace Health Podcast. I'm Garlana Matthews, President and Editor of Workplace Health Magazine, your trusted source for comprehensive information on workplace health and wellness. Each month, I will be sharing interviews with leading industry experts to empower employers with the knowledge and resources needed to create and sustain a culture of wellness. Whether you're a business owner, HR manager, or employee, Workplace Health is your go-to resource for staying up to date with the latest trends and best practices in workplace wellness. If you're ready to address the diverse needs and challenges faced by businesses today, you're in the right place. Let's get started. This month, we are joined by Mark Pew with more than 40 years of experience in property and casualty, healthcare, and technology. Mark has been the mastermind behind solutions that transform the way the workers' compensation industry navigates utilization management and treatment, particularly in the area of opioids and other potentially high-risk medications. We're so excited to announce a new project with Mark that you'll learn more about shortly. Good morning, Mark. We are so excited to have you on our podcast today. We love Work Comp College, and we love what you're doing for the industry, and just so excited to have you here today with us.
Well, thanks for inviting me, Garlana. It's been fun to get to know you and Michelle and your team, and it's a great partnership. We really love working with you.
It's definitely needed in our industry, Mark. We have a lot of the senior professionals retiring, and they're taking all of that wonderful knowledge with them. And we need Work Comp College to help provide training for the young individuals that are coming into the industry. And it's so important, and we love what you're doing.
Well, thanks. It started fairly simple. We had a very narrow focus of helping to train brand new claims adjusters who were not getting the kind of immersive training that they used to when they would literally go to Boston or Hartford or Austin for 2 or 3 or 4 weeks of immersive training. So it was really focused on those brand new people. But our very first graduate was someone who'd been in the claims industry for 25 years and literally changed how she did stuff based on what she learned from our faculty. Our second graduate was a doctorate in physical therapy who was dealing with injured workers. So it has evolved into 8 different certifications, our advanced training and education center, custom training platforms, and certainly our partnership with you, with DocWise, and with the WIC Mix Live that we did a couple weeks ago in Atlanta area. So couldn't be more interesting in how we started versus how we are right now.
Talk about a little more about DocWise and the program that we helped you create. We know that this is going to be important for physicians that we work with. We want to make sure that the physicians understand workers' comp, especially in Georgia. We started in Georgia, but we want to grow this to other states. So if you could tell us a little bit more about the program and how we've expanded, I'd appreciate that.
Yeah, absolutely. Well, I earned the RX professor moniker over about 20 years of engaging with the overprescribing of opioids and then biopsychosocial treatment plan, and then talking about cannabis and talking about virtual reality. So I'm really plugged into a lot of physicians, clinicians, behavioral psychologists, a variety of people around the country, and have learned a lot from them. So when you came to us and said there are a lot of treating physicians or medical provider offices that don't really understand comp, either they're doing comp and they don't really fully understand it. They have high turnover in their office. So every six months or 2 years that they're developing brand new people to understand comp, or they're kicking the tires on comp and have heard that compensation from workers' comp is kind of the golden ticket, but they're not really sure what they're getting themselves into. So it really kind of prompted us to think about what would it be like, because most of our content up to that point was really dedicated to stakeholders in work comp that were more claims adjusters, case managers, ombudsmen. We train all 75 ombudsmen in the state of Texas, regulators, just anybody that's perceived with that. But we really hadn't focused on content dedicated towards the medical providers, the physicians and the clinicians. So it really got us to thinking when I still remember that long dinner that you and Michelle and I had, and we kind of ideated through what you perceived was the gap and how we could fill that. So we focused on something short duration, because medical providers, especially physician clinicians, can't take their eye off the ball in regards to treating people, because it's only through treating people that they can get paid. And so having something that was long and laborious, it was going to take a lot of time, just wasn't something that was going to fit their overall philosophy and kind of how they did. So we focused on 75 minutes of training, talking about the foundations of work comp, just generally what work comp is, the lexicon, because we use a lot of acronyms and phraseology and work comp that they've never heard before. Then this typical claims process from the initiation of the claim, the actual injury or occupational disease, to the closure and settlement of the file, and then some tips and tricks on how to fully engage and do things well, do things as expected by work comp, which is really focused on return to work, functional restoration, which is a little bit different than if someone has Medicare or Medicaid or private pay, where the focus really isn't necessarily on return to work. It is on return to function, but it's a completely different kind of aspect to that. And so we focus that content on there in regards to those four pillars. And then to your point, those pillars are agnostic to jurisdiction. They're best practices that are really applied anywhere. So we really kind of focus, well, Georgia's different than Florida, which is different than South Carolina, which is different than California. And so we added to that specifics on Georgia, the forms, the panel, what the expectations are. And we did Florida, which is completely different again from Georgia. So we've got about close to 40 states now that are done, that have, in addition to 75 minutes, 25 to 30 to 35 minutes of content specifically on that jurisdiction. So the goal is for them to go through the jurisdictionally agnostic content first to understand what work comp is. And then on top of that, layer on what is unique to them. If they're a medical provider office in Georgia, what do I need to do specific to Georgia? Set aside the best practices, but tell me what I need to do in Georgia versus Florida, South Carolina, et cetera. So it has grown. Y'all are doing your best to promote it within your client base. We're doing a lot of marketing and promotion, and we've actually got several deals in the works right now for national application of this for people who are working with medical provider or representing medical providers. We're talking to some clients or prospects right now that manage networks and want to use DocWise as a training mechanism or even a vetting process to make sure that only the providers that go through DocWise are the ones that get the predominant number of referrals, because they understand comp as compared to someone who hasn't gone through it. So it was a very productive dinner that you and Michelle and I had from your perspective on a gap that we hadn't recognized. And it has been consistent with Work Comp College. We hear an idea. Our board of directors get together. It's four of us. We get together and go, hey, we came up with this idea. What do you think? Everybody goes, that's great. Then we do it. So that's the advantage of being our own bosses, as opposed to having layers of bureaucracy that we need to think about it for a while.
This is true, Mark. I've been doing this for over 30 years. I'm kind of telling my age at this point, but
you're just a young teenager.
Yes. Yes, I want to leave the industry better than when I started in 1991. I want the young professionals to have the opportunity to learn from these the people that have been doing it for so long. This experience, for them to retire and take that knowledge with them, is scary. So for you to preserve that and be able to continue teaching, I'm so excited about this opportunity. With our physicians, this program has been really, really good for our physicians. And we have industry professionals reaching out to Michelle and myself, wanting to know the physicians that are doing workers' comp really well. And so we're kind of vetting those physicians to make sure that they're getting the very best of the best. So we decided to create the panel listing so that professionals, work comp adjusters, case managers, employers, and defense attorneys can go in and rate these providers on their best practices. So in April, we're excited to be working with you to launch this program for the industry, so that they will be able to grade these providers on the services they're providing. So this is something new that we'll be launching in April with Mark, and I'm so excited to be on the forefront of this and being able to offer these services to professionals.
Yeah, it's exciting and dangerous to get a text message from Garlana because it's constantly ideas. And this was another idea that you presented to us, what we're calling the WPH Provider Hub, which allows participants in work comp to grade the medical providers that are involved in that, and then to generate the panels for panel states like Georgia is going to be our initial rollout, where the actual panel form is automatically filled out based on you selecting the providers that you want to put in there, which automates that process, but also gives you more visibility. Because oftentimes in Georgia, you're selecting providers to be on your panel that you may or may not know much about. And it may just be from what you've read about them, or maybe you saw one of their clinicians on a panel at a symposium hosted by Workplace Health. And it's like, they sound like they know what they're talking about. So let me dig into it. But having everybody in the industry kind of rate them on the compliance with treatment guidelines, with their return to work statistics, with the ability to communicate with all the stakeholders effectively. It's somewhat subjective, somewhat objective. I don't rely solely on Yelp for picking restaurants, but it does help to kind of understand, what their cuisine is, how good is their service, is the food hot, all those different things. Is the customer service staff helpful? So even though it's subjective, it gives me a little feel before I go to that restaurant or even pick that restaurant, whether it's a good choice for me if I've never been there before. And that's kind of the concept behind Provider Hub. Subjective, objective information, but referenced by a variety of different people, and you can kind of look at it and go, okay, if 50 people like them and they've had good results, and the patients, the injured workers that go to them return to work faster, which means my total cost of claims is reduced, and my injured worker is a happy employee that's come back to their job. Their supervisor is happy because they got the person who actually knows how to do the job back quicker. Everybody wins if the duration of that claim is faster and the recovery is more complete. And so having that subjective information, so when you're trying to choose panel providers or just someone to refer an injured worker to, that information is helpful. So that was one of those text messages that I got from Garlana. It's like, oh crap, I'm not really sure if this is good news or bad news. But it turned out to be, again, a really great idea that now we're working to develop that application, and we'll be hosting it on your behalf. And we're really excited to launch it in April. User registration, our plan is to have user registration in time for your symposium here in Atlanta on March 31st. So people can start getting lined up for that, and then we'll be rolling out the application as it's available.
Well, the one thing I'm excited about this, I was thinking with the physicians, if their rating dips, if they're having some issues, it could be that maybe the physician assistant does not have a true understanding of workers' comp. It could be the staff, not the physician. So when we get these ratings, we can notify the office manager within these practices and say, and recommend training through Work Comp College to improve the system. So I'm truly excited. I think, if there's someone that needs training, this will definitely give us the information so that we can reach out to those providers and their office managers and recommend your platform, Mark.
Well, and I think that remediation process, that consulting, if you will, to your point, and I think that's a brilliant idea. It's like if the trend is lower and lower stars, something is happening. And rather than not getting referrals and not knowing why, you can proactively reach out to those providers and go, hey, we're getting some feedback that can we help you kind of figure out where that weak link is? Is it the backroom staff? Is it a clinician who's got really good technical proficiency, but doesn't have good bedside manner? And so they're getting feedback that the injured workers are walking away more confused than they were when they walked in. There's a variety of reasons why, but you can help kind of tease that out, given your experience. You can help kind of tease that out, help them remediate that, help them to fix that problem so that the trajectory starts going back up as opposed to going down. And so that information, I think, is going to be key to a variety of different stakeholders, the ones who are trying to figure out which physicians or clinicians they want to engage with, as well as you helping physicians and clinicians refine their process, and then knitting it together potentially DocWise and some other curriculum that we have on our content that could be a part of that remediation process, or just continuing to try to get better.
Mark, with technology changing, how have we got to this point with training?
Well, it's been interesting. If we had launched Work Comp College in 2008, it wouldn't have happened because people were not used to asynchronous, self-paced online learning. There were some outliers, related to that, but most people were used to getting their content, their curriculum, their CE credits, et cetera, in in-person events, going to conferences and stuff like that. But COVID was a game changer in a variety of different ways. There were a
Mm-hmm.
lot of bad things that happened from COVID,
Yes.
but one of the silver
Mm-hmm.
linings is people got used to consuming their content online, to pursuing their professional development online. And so when we launched in 2022, it was a good answer to an evolving industry. Back before COVID, if we were going to have a meeting, it would have been either in person or a phone call. Now, if I'm not on Teams or Zoom with someone and seeing their face, it seems like a failed opportunity. I don't want phone conversations. I want to be able to see people,
Right.
and understand their nonverbal communication and be able to relay information back and forth. So the industry has changed quite a bit post COVID, in relation to kind of the expectations of how we communicate, which has opened an opportunity for us as an online training platform. But it's opened up a lot of opportunities for brand new people. One thing I noticed when everybody went to webinars, because there were no conferences. I mean, COVID only lasted, let's be real, only lasted about 6 weeks in Georgia. But it lasted a lot longer in other places.
Right.
And so all of the in-person events went away. And so there were a lot of webinars. And what became very evident is the same people couldn't do the same webinars every day. And so they had to go out and look for new speakers. In my mind, 2020 and 2021 was the great democratization of speakers, because we had to go
Mm-hmm.
out to not the same people that have, once you get into the routine of being a speaker, which I have been for 15 years, it's hard to get in. But once you're in, you get invited and referrals and stuff, but getting in is hard. And what 2020 and 2021 invited was an invitation to a lot of people that were very smart, had a great perspective on things, but had never been given the opportunity to present their material, their content, their subject matter expertise to others. And
Exactly.
so, by virtue of having a gazillion webinars that needed spots, we sought other people that needed that spotlight. And I was very happy to bring those additional people into the spotlight, give them that stage, allow them to share their subject matter expertise. So we're actually stronger as an industry, because now it's not the same 15 people that you see all the time, but we got a variety of people from a variety of different perspectives, ethnicities, languages, backgrounds, socioeconomic, geography, you name it. We got a whole bunch more people in the industry that are now known and have created platforms for themselves. And that, to me, excites me. We've got over 180 faculty members as a part of Work Comp College. And amongst those, probably at least half of them are people that nobody had ever heard of, but we either discovered by in-person, networking and stuff, or I'd seen them
Mm-hmm.
on a webinar and recruited them. So we're into that democratization. We're inviting people that have never been given that platform or that stage to be able to contribute their subject matter expertise. And to me, again, as a longtime mentor and mentee, I love to see and be giving opportunities to people that are really smart, to be able to relay that intelligence and that subject matter expertise elsewhere. So the timing, even though COVID really was bad on so many different levels, the timing for us, and I think the expansion and the preparation for the gray tsunami and work comp with the industrialization and getting more people involved, COVID actually was a silver lining.
Thank you so much. I really appreciate you going into detail with that. You are so detailed. That's one of the reasons we've partnered with you. You do not miss a beat.
Well,
Love it.
it is a blessing and a curse. My business partner Bob Wilson expects 42 emails, of 47 paragraphs each every Monday morning at 9 a.m. And so it is a blessing and a curse. And a lot of people that I've worked with have turned my name into a verb. Being pewed is not like Pepe Le Pew, but it's like, oh my gosh, I'm drinking from a fire hose. So I love detail, and I love. I have a business analysis background. I actually grew up in technology from the very beginning, software development, project management, management, all that kind of stuff. But the business analysis, which is, and I've done this a gazillion times, is have a piece of paper or a back of a napkin, and I have someone who's really bright and has some really great ideas, but haven't really have been able to figure out how to create something from that, is me taking notes and then creating from someone's thoughts and from my notes something that's tangible, a product that actually helps people, is what gets me up in the morning, as well as mentoring. I love mentoring. I love chatting with people who have not had the benefits of being on the stage like I have not had the benefits of being heard or being listened or being invited into rooms because they never had anybody to invite them. So I've mentored so many people through that. To your point about the institutional knowledge that's walking out, we need that next generation that has that gut feel, that instinct. And that only comes from doing it and from sitting at the feet of variety of people. So, and I've been menteed. I've been a mentee of so many people: clinicians, claims adjusters, regulators, attorneys, you name it. I've sat at the feet of the smartest people in our industry and beyond our industry, and all that's been kind of synthesized in my head. And then I relay it, and I think I'm about 735 presentations now over the past 15 years around the country and internationally. And all of that information that's come into me has been synthesized, and then I put it out in my Georgia Redneck lexicon that makes it very easy to kind of understand. And so I'm really passionate about, and that's what really is our mission at WorkComp College, is to bring that next generation up and to give them access to experts, and then to be able to formulate their own kind of verbiage and their own brand so that then they can take their place up on stage in the spotlight, saying important things to important people. So our partnership with you is all about kind of that give and take of our mission and your mission to make the industry better.
Well, thank you. Thank you for being with us today and sharing all this wonderful information. And we look forward to rolling this program out and working to make it even better.
Absolutely. It's always a pleasure to work with you. I kind of joked that your text messages are either a plus or a minus, a good way to start the day, or, oh my gosh, my life is going to change dramatically. But all joking aside, it's been wonderful to work with you. And every conversation I have, I leave inspired and motivated. And I leave with some good ideas, either for us or for us together as a partnership, to make the industry better. So I always look forward to your text messages and phone calls because I know something good is going to come from it.
Thank you. Well, let me know if there's anything else. I'm sure we'll be in touch soon.
Oh, absolutely.
Thank you.
Thanks for the invitation.
Thanks for tuning in to Workplace Health. I appreciate you spending your time with me today. Don't forget to follow us on social media, subscribe, leave a review, and share with an industry professional. Stay curious, stay kind, and we will see you next time.